Hello, I'm Dr. Valerie McLaughlin, Director of the Pulmonary Hypertension Program at the University of Michigan, and I'm joined today by my colleagues Dr. Richard Chanik and Dr. Ioana Preston. Today we're going to discuss some of the key takeaways from the 6th World Symposium on Pulmonary Hypertension, and the topic in particular is genetics and genetic screening. For me, this was an important takeaway that I think changed my clinical practice. We actually started changing how we approach this as we see patients based on what I learned from this task force at the 6th World Symposium. Dr. Preston, tell me a little bit about the approach to genetic screening. What do you recommend these days?
So Val, for the past few years, we've learned quite a lot of information about genetics in pulmonary hypertension. We know this particular disease has a strong genetic component, and the most common gene involved is BMPR2, or bone morphogenetic protein receptor 2. What we've learned recently was the degree of penetration of the mutation. For example, we know that the vast majority of familial PAH patients, up almost 90%, have a mutation in the BMPR2 gene. And of those family members who also carry a mutation, the penetrance is quite high, is 14% in males and 42% in females. So the risk of developing the disease in family members who carry a mutation is very high. We then learned that we should offer genetic counsel to the families and to the patients, and if they agree, to follow them yearly, non-invasively, to make sure if the disease occurs, we catch them early.
Right, and so there are many genes identified, really. So BMPR2 is the most common, right. But it seems like every year there's another, such that about 90% have some gene or another identified. Yes. So we've started doing this based on the recommendations. We are offering genetic screening, or at least trying to identify a gene in all of the new idiopathic PAH patients that we see, because a proportion of these will actually have a gene. Rich, let's say that a family gets screened, a gene is identified, and the unaffected individuals in that family get screened. It's great if they don't have the gene. You never have to worry about looking for pulmonary hypertension. But as Ioana said, it's just a proportion. About 15% of men and 42% of women will go on to develop pulmonary hypertension. What's your approach to monitoring those unaffected individuals who are mutation positive?
Yeah, I think the key is that they should be monitored. Those numbers of 14 or 42% are striking, really, if you're thinking of a potentially fatal disease. So it really makes us take attention, and so if you have a mutation and you're in one of these families, you need to be followed regularly. And that sometimes easier said than done, and certainly non-invasively. I think things like cardiopulmonary exercise testing, echo, stress echo, for people that tend to do those. Obviously, symptomatic following, and really stressing to the individual that if you notice any reduction in your exercise capacity or new symptoms, we want to see you. So those type of things.
And you say cardiopulmonary exercise testing rather than 6-minute hall walk, just because it's more sensitive for earlier disease at higher levels of exercise capacity.
Exactly.
Yeah, so it's a really fascinating area. We are now working with genetic counselors at our institution to really follow through on some of the recommendations that were made by this task force.
What I'd like to add is genetic testing for pulmonary hypertension is not widely available at every practice. So I would encourage the practitioners to consider referring these patients for genetic counseling and screening at the centers who have the availability of doing genetic testing.
Right, so it's not just the testing, it's the counseling that goes through it.
It's the counseling that's very important.
Yeah, so that's a great point. Rich, Ioana, thank you for joining me. And thank you for joining us to talk about some of the highlights from the 6th World Symposium as they pertain to genetics. Thank you.